The world braces for an outbreak of monkeypox, formula shortages don't seem to go away, and food prices are up over 8.5%. What do we do with all this information while we're trying to maintain our health in a good, sustainable way? We'll break each one of these topics down one by one. Hi Wellness Warrior, I'm Dr. Zyrowski, and there's a lot of crazy things going on in the world today. And for you and me, one of the things we want to know is, how do we maintain our health? How do we take care of ourselves? How do we maintain eating healthy? What do we have to do? Well, let's go ahead and first start with monkeypox. Now, according to an update on the CDC's website, cases of monkeypox have been reported in Europe, North America, Australia, and they also added that these cases were amongst homosexual males. Some cases were also reported by people who lived in the same household of the infected person, okay? So as we look at the billions of people worldwide, we're looking at about 500 cases of monkeypox. UK has the most cases, and next on the list is Spain, and then Portugal, and if you look at the United States, it's way down there on the list. Now, once again, this is showing up in homosexual male communities, okay? This isn't some widespread issue that's just ravaging people's homes, nor will it likely ever be that scenario. Now, I think this is a big nothing burger. I don't believe this will amount to anything. I do believe that the media and potentially politicians and definitely Big Pharma are going to try to stir up as much hysteria as possible with this whole situation, because there's a lot of money to be made. There's a lot of power to be grabbed from people. And, when it comes to the media, if they're scaring people, then their numbers go up. So I think that you'll see a lot of hysteria about this. I also see that there's going to be a lot of opportunists come out. And if we look at, an example of some monkey business associated with monkeypox, I mean, Joe Biden's already went and purchased $119 million worth of vaccines. I'm just kind of wondering when politicians will stop shoveling copious amounts of taxpayer monies into the pharmaceutical companies. I mean, these companies are the largest, most powerful, richest companies in the world, and yet the government continues to inject itself in healthcare issues, just funneling tons of money to them of the hard-earned taxpayer money. So the government did an awful job with COVID. I mean, from telling people to mask when we later found out that the masks were garbage, and then they still continue to tell people to mask. And then they told people that you need to social distance. And once again, Johns Hopkins came out with research, not only that social distancing didn't work and lockdowns didn't work, the government continued to tell people to do it, even though we had proof that it didn't work. And then they went as far as telling you to pretty much inject half your body weight with vaccines and you would never get COVID. And sure enough, everybody went and injected half of their body weight of vaccines. And then everybody still got COVID once and twice and 3 times after that. So anyway, they've proven to do an awful job, so I don't think anybody's interested in their advice at this point. Now, some other monkey business that's really interesting around this monkeypox issue that should raise everybody's eyebrows is that there was a tabletop simulation exercise of a monkeypox outbreak that took place in March 21. So essentially what they did is they said, oh, there's this potential for this monkeypox outbreak. Let's basically go and kind of run through a scenario of what would happen. Well, they did the same thing with COVID. And then after they did that with COVID, with this event 201, sure enough, like a year later, COVID shows up. Well, now they did it with monkeypox, and sure enough, a year later, then all of a sudden monkeypox shows up. So it's like, you know what? Everybody complains about conspiracy theorists, but it's like when you start looking at the facts here, it's like, how come they seem to be right in all these situations? And then another thing that would definitely raise eyebrows is that it turns out that they were developing monkeypox in the Wuhan lab. Now, it already existed in other places of the world, but they were actually going and creating it within the Wuhan lab. They said they didn't have access to it and they wanted to study it. And so instead of just going somewhere and getting it off of a human body that has it in another country, they said, oh, we don't have access to it. So as they're creating it, it's like, oh my gosh, like this whole Wuhan lab thing, it keeps getting worse. So the CDC concluded that the risk to the general population remains really low with monkeypox. It says that people should seek immediate medical care if they develop any new unexplained skin rashes and lesions, or even fever with or without chills. Now, here's the thing about this. When it comes down to any of these things, whether it's monkeypox or it's COVID, whatever, you have to focus on boosting your immune system and taking care of your health. If you're suffering from a chronic health condition, an autoimmune disorder, diabetes, high blood pressure, cholesterol issues, metabolic issues of any sort, if you're suffering from these issues, you need to work on taking care of them, right? Because that's how you protect yourself. You take care of these issues that exist that are depressing your immune system. You make sure you have sufficient levels of vitamin D, vitamin C. You use things like NAC, and you boost your immune system, and then it fights this stuff off. It's amazing how that works, okay? We know full well that poor outcomes associated with the pandemic was in people with depressed immune systems, right? Mostly from obesity, but obviously there's a lot of other reasons that can happen too, so we have to take care of ourselves. So the lesson learned is take care of yourself so you don't have to be subject to all these, people lacking any intelligence at all telling you how to take care of your health. Now, the next topic is food shortages, and this one's actually pretty interesting to me because obviously you're gonna have poor health if we have food shortage issues. And so this is concerning to any of us who are trying to take care of ourselves and eat right and eat healthy. There was a report that people don't analyze what's going to hit them come this fall, a Texas farmer had said. They think it's tough right now. Give it until October, food prices are going to double. Now, food prices are already up 8.8%, okay? You have to look at the costs that are hitting the farmers right now. So you're experiencing 8.8%, but farmers are experiencing much worse than that right now because they have to pay up front in order to plant their fields. And so you're going to experience what they're experiencing right now this fall. So this is something that we have to, be really aware of. Now, the article goes on to say, usually what we see on the farm, the consumer doesn't encounter for another 18 months. But with the severity of these costs increasing, consumers could feel the effects much sooner, particularly if the weather becomes a factor. The prices now have not hit the grocery stores yet, but they are expected to by the end of summer. Much of the cost of food hinges on the price of oil. They have no electric trucks delivering that food, and there are no electric tractors. It takes diesel to run everything. And this is one of the ironies of, in general, the government trying to push everybody towards electric vehicles and electric everything. Sure, there could be a lot of benefit to that, but you are going to just really cause people to struggle. I mean, at the end of the day, when it comes to food and everything, it all is hinging on how much it costs to put that food into the ground. And you might think to yourself, well, I don't eat a whole bunch of corn, I don't eat a whole bunch of soybeans, but yes, you use animal products, and that's how these animals are fed, right? So it's important to realize that this will affect you. This is how farmers take care of their grounds. And I live in a farming community, so I hear farmers complaining every day and how much it is costing them to plant their fields. And I know that this is a huge problem because it doesn't stop there. It's not as if they're going to have to just take that all in the chin and nobody's gonna have to pay for it. It's just that when they go to sell those crops, it is going to jack up the prices of food enormously. So one farmer had said that fuel and fertilizer together make up 55% of his total cost. The price of diesel fuel has more than doubled to more than $5 per gallon today from $2.50 a gallon at the end of 2020. Farmers say that the cost of fertilizer and oil derivatives have tripled, in some cases quadrupled. Okay, so oil's going up. And then the other thing you have to look at is fertilizer has gone up dramatically. So what you're looking at, if it's costing the farmer quadruple to plant their field between fuel costs and fertilizer, then you're going to find likely the food in your grocery store quadruple. Okay, that's what you would expect to see. So what do you do about all this? Well, one of the things that you can simply do is maybe stock up on some foods that are going to be foods that stay good for a long period of time. Okay, so if there's foods out there that you can store, you could always stock up on those. Well, it's cheaper because the food prices are going to definitely go up. Now, the other thing that you certainly could do is you could start a small garden at your house. I think that we're potentially moving towards a time where people are going to start considering gardening more. I mean, who knows what this whole food thing is going to turn into, but people may find themselves needing to garden more, needing to actually develop relationships with local farmers. I think this is a big deal. Have relationships with local food sources. If there are some farmers markets down the road from you. Go ahead, go there, get some products from those guys. And then the other thing that you could do is develop relationships with them so that maybe you can buy directly from them right from the farm. You can save a lot of money that way, that in a lot of cases, versus buying from the grocery store. So that is a good workaround too, because if there's a food shortage, I mean, honestly, the people who are going to be really hurt by it the most are people who live in large cities that don't have direct access to food. Like for instance, where I live out in the country, I mean, I can go to pretty much anywhere and find food. But if you live in a high rise, which I've done this before, I've lived in the city, living in a condo, multiple floors up, like the only access you have to food is the stuff that's brought to your grocery store. So it's something to consider. Now, the next topic is the FDA pretty much admits that they had a delayed response in regards to shutting down this baby formula operation, and they shut it down for a long period of time, which caused this huge shortage in the marketplace, and they failed to reopen it. It's really their fault. It comes back to them, our government literally just doing a crappy job at most things that they do. And so now we have this huge shortage. What do we do about it? So I was looking around doing some investigating, and what I had found is that a lot of the really low quality baby formula is the formula that we're seeing shortages in. When we look at better quality organic formula and high quality formula that's not using just garbage products like soys and fillers and all kinds of, high fructose corn syrup and things that you don't want your kids having anyway. When we look to some of the better quality stuff, there seems to be a lot of that still on the market. I literally couldn't find a place out of stock out of any of the really good quality formulas that exist out there. So if you're looking at like organic or just ones that are using good pure ingredients, I found that there's a lot of that out there. Now, I think that like as far as the shortage, there's nothing I can really tell you in that realm. But what I can tell you is that a lot of the baby formula is just complete trash. And so I hope that maybe through this shortage, people realize like, you know what, maybe the conversations will come up more and more that a lot of this baby formula is garbage anyway, and that we should actually be looking to some better quality stuff. Now, also, I've heard many people say, well, you know what, maybe the moms just need to breastfeed. Well, I understand that that's easy to say, but I also realize that's not a reality for all women in all cases. Now, a lot of women don't understand how important and how critical it is to breastfeed their baby and how beneficial it is. So they just don't do it. They just hear that you can bottle feed and it's kind of the same thing, and it's really not. So obviously breastfeeding your child is going to be the best thing that you can do for their overall health. But let's say you're a mom that works. Let's say that you had some sort of, trouble at the beginning of your pregnancy and you weren't able to breastfeed. There's a lot of scenarios out there. As a father of 5 children, I can tell you beyond a shadow of a doubt that it's not a reality that all women can breastfeed in all cases. So formula is necessary, but you want to make sure you're getting the better quality of stuff and not the cheap garbage formula. And like I said, if you look on the market, you're going to find that there's a lot of good quality formula that is available that you can order today. And so look out for that and make sure you're making wise choices for your children's health. If you enjoyed this video, I think you'll really enjoy this video next.